Thomas Baldrick here at ASH 2014, joined now by Dr. Martin Griesshammer from Germany. Thanks for stopping by, sir.
It's a pleasure.
Let's talk about your phase 3 study dealing with the safety and efficacy of Ruxolitinib. If you would just provide an overview.
Yeah, it was an expanded access trial dealing on Ruxolitinib patients with low platelets, meaning between 50 and 100,000. And the aim was efficacy and safety of Ruxolitinib in this setting.
What are the risks with patients with low platelet counts?
Well, major risk is bleeding, and this was one of the concerns, and there were previous studies, but they restricted to patients with platelets above 100,000. So it was interesting to see whether there is a bleeding issue or not.
And what did you find?
What we found was that Ruxolitinib is safe, and that bleeding events did only occur in 2 patients, and this was not clearly due to Ruxolitinib. We saw that Ruxolitinib is efficacious and safe.
What were some of the key results?
Well, key result is that we saw that the decrease of splenomegaly, which is one of the major targets in Ruxolitinib treatment, happened as well. Not in that extent with a greater dose, but it happened, and that the patient had a profit clinically from this drug.
If a platelet count is too low, what is the concern there?
Well, too low means below 50,000. Then the bleeding risk is very high. But this was not in the study. So we avoided that the platelet counts went down to 50,000 below. So we stopped the drug if the patient fell below 50,000.
What do you do in terms of next steps?
Well, the next step is that we will increase the dose. We started with 5 milligrams twice a day, and we saw that this is a safe dose, and probably we can get a bit higher, and that means that it will increase efficacy. And these are the next steps we do.
It's good news these days for myelofibrosis
Absolutely.
patients, isn't it? How much so in what you've seen?
Well, it's a new drug. It's licensed in Europe since 2 years now, and it has done much progress for the benefit of our patients.
Very good. Thank you, sir. Appreciate your time.
Thank you very much.